Hey everybody, Dr. Dane, and I want to talk to you about something that I feel creates bad backs, and that's tight hamstrings. And a good test for your hamstring is just to lay on your back and see if you can passively or actively raise your leg and get it up to about 70 to 90 degrees of flexion. So bring it up. If you can get it to 90 degrees, that's a really good sign. And the reason your hamstrings are so critical is that they attach into a part of your pelvis called your ischial tuberosities. And your ischial tuberosities they call your sits bone, because when you're sitting right on that part of your pelvis. The problem is when your hamstrings are tight, it tends to cause a posterior tilt in your pelvis. So this is anterior, this is posterior. So the hamstrings contract and they pull this pelvis forward. And what that does is the natural arc in your lower back is there to support and create flexibility for your lower back and your discs. When your pelvis is pulled into this posterior tilt, it flattens that lumbar curve. Now you have your whole body weight compressing those discs, those soft discs, and the joints of your lower back. And you tend to get a lot of compression, a lot of pressure, and it creates really bad backs over time. So the key with this obviously is to stretch your hamstrings. Now the reason that hamstrings get tight is because when we're sitting, our knee is flexed. And when our knee is flexed, we're not stretching the hamstring. You saw when I was laying on my back, lifting the leg straight, not with the knee bend, is the way we stretch the hamstring. And that's exactly what's going to help if you have a tight lower back, because I will tell you after 25 years of being a chiropractor, you can almost see a direct connection between chronic lower back pain and tight hamstrings. So if you sit a lot or you have tight hamstrings, you've got to get working on your hamstring and lengthen them so you take the pressure off of that pelvis so it moves forward again and puts that curve back into your lower back. So this is Dr. Dane with your health tip of the week. Get stretching those hamstrings. It's easy to do. Lie on your back, use a belt or a yoga strap. Get that knee up. You can start in flexion, so you can start here and flex the knee, have that belt. So you're going to pull the knee up with the knee bent. And then from there, with holding onto the belt, you can then put it into full extension and pull and hold. And the key is both those positions flexed and the knee extended. You want to hold that for a good 30 seconds to a minute in each position. And watch what happens if you have chronic lower back pain. Watch how that improves your lower back pain. So this is Dr. Dane with your health tip of the week.